Hi, I'm Steve Greenberg. I'm chair of the International Stroke Conference, and I'm here with Dr. Pooja Khatri from University of Cincinnati. And Pooja, we've heard really very compelling presentations about the IMS III trial, and then your particular presentation, which was added a lot of light to our understanding. Can you tell us about what you talked about?
Sure. So as you know, we found that the IMS III trial did not show a benefit of IV combined with endovascular therapy compared to IV TPA alone. And one of the reasons we thought that might be the case was a delay in treatment into endovascular therapy, and specifically to opening up the blood clot. So we wanted to look at the role of time to reperfusion and its relationship with clinical outcome. So from the analysis that I presented, what we did is we took the patients that had larger clots, ICA-T, M1, and M2 occlusions, and we looked at we looked at that subset and looked at those whose arteries actually opened up, looked at the timing of when they opened up, and looked at how it was associated with outcome.
Right, and what did you find? What was the association?
Yeah, you know, we'd looked at this before in the IMS pilot studies, and we found the same thing again, and we were struck by the reproducibility of it. What we found was that the longer you went, the less likely you were to have a good outcome. In other words, the longer it took to open up the clot, the less likely you were to have a good outcome. In fact, for every 30-minute delay in opening up that artery, there was a 10% relative reduction in good clinical outcome.
Right. So would you then argue from those data that the failure to show superiority in the arm that included intraarterial therapy was mostly driven by a failure to reperfuse as fast as you would need to?
Sure looks like that. You know, I think there's always been the hope that we've known time is brain with IV therapy, and I think there's been the hope that maybe we have more time, or maybe time is less relevant when you're actually doing a better job of opening up arteries more frequently. And what we're seeing is that time clearly matters, and if we'd gotten to the clot faster in the endovascular arm, we would have had better outcomes and overall had a positive trial.
So as you're looking to the future very hard after all the effort that's gone into IMS III, but learning from that, do you think that the future would lie in devices that open arteries faster? Is that where the data would point?
I think so, opening arteries faster and also setting up our systems to treat as quickly as possible. Right. I think that's where we're going to make the biggest impact on our patients, in terms of specifically our patients with severe strokes.
Were there data from IMS III that would help you in how to change the system so that you could move people more quickly to reperfusion?
I would say that what we noticed the most was that I think that we did a great job of starting IV TPA quickly. IV TPA on average was started within 2 hours of symptom onset, and that's about as good as we think we can do. But other than without major public health efforts to get patients in sooner, but based on when patients currently arrive. I think where we can do better is going from starting the IV therapy to starting the IA therapy, and that is an area where we can streamline things better. The other thing which you alluded to was faster devices could really shorten that angio procedure time. It's hard to imagine shortening that time period from groin puncture to starting IA therapy, because some of that is just twisty vessels that patients may have, but some of it could be interventional experience. Well, the interventionalist experience.
It really gives us a lot to chew on, and of course on behalf of the whole community, I want to thank you and the IMS III investigators for all the work you did, and thank you in particular for sharing your results at the International Stroke Conference. We hope that everyone has enjoyed it. We know that they will.
I greatly appreciate the opportunity. Thanks.